Deputy President David Mabuza completing that live report by our reporter Artie Mtungana in Parliament. Artie, thank you very much indeed. Well, it's International Nurses Day being celebrated around the world every year on the 12th of May, the anniversary of Florence Nightingale's birth. The theme, of course, for 2021, Nurses, a Voice to Lead, a Vision for Future Healthcare. You can imagine over the last year how difficult it's been to be a nurse on the front line during COVID-19. Well, we're joined now by a nurse from Nduduzi and Lawful. Nduduzi, good afternoon to you and happy International Nurses Day to you. I imagine in a way this is actually quite a difficult day. If you look at what's happened in nursing for you and your colleagues over the last year, I can't imagine any time in our history that will have been more difficult for you.
Good afternoon, Stephen, as well as the Pulse viewers on 405. It has been a tremendous turmoil for us as health workers, because monitoring the developments of the COVID-19 pandemic from 2019 in December in China, and whereas in 2020 we were still observing around Africa where exactly we were going to be the first or among the first countries to face this pandemic. So it hasn't been easy at all, considering that our profession already has a burden of brain drainage, that we are not enough, short staffing, overburdened with a high nurse-patient ratio, and here comes a pandemic that no health professional in the world was prepared for, to actually impact on the health system.
I've been in a newsroom as a journalist where a member of your team you suddenly hear on WhatsApp, or they phone and they say, I've been hurt during a protest, or something has happened, and the shock you all feel. For you as nurses, during COVID-19, when you hear that a colleague has tested positive, or a colleague you know has an underlying condition, has tested, a diabetic colleague has tested positive, or someone is seriously ill, or you're treating a colleague, Nduduzi, I can't imagine what that must be like.
It was quite stressful, to be honest, because it was cluster outbreaks. It can be within your department, can be the X-ray department, or any other primary healthcare facility. So it was quite a stressful and anxious time for us, because this is where even some of the information will be held to try and relay anxiety amongst us, to say, do not panic, let's just be there together. Spirituality was a vital point of survival for us, because if we did not have spiritual strength actually to face this pandemic, most of us would have actually given in to the anxiety of the pandemic. But we remember that this is our profession. We made an oath to the country, to our citizens, our patients, that we will guide them through, because HIV is still amongst one of the most prevalent pandemics that we are still battling and trying to assist our patients within the country. So we could not just give in to this new pandemic.
I mean, one of the things, it's an image that stayed with me. It's an international image of a group of health workers, I think in the United States, all covered in plastic, hugging each other, because it was the only way they could do it safely. And you can't, sometimes I want to go and find nurses and hug them. You're not allowed to do that. I mean, that must make it tougher, particularly when there were claims that the PPEs you were receiving weren't correct.
Oh, that was one of the most disappointing moments in our country, no doubt, in that we were given substandard PPE, because prior to the pandemic, we were actually having proper PPE in the forms of N95 masks, be it 3M or other approved manufacturers, where we were using them primarily for those TB pandemics that we still have, as well as the Ebola suspects and other highly infectious communicable diseases in the health infrastructure, in the health fraternity. So it was quite disappointing for us, because along with those issues, pandemic allowances, risk allowances, the issues of not receiving your claims from the Department of Labor when you are injured on duty under the Workmen's Compensation Act. Those were some of the things that were impacting above the crisis that we are having with the public wage disputes over the salaries, that in the second year, all health professionals and other civil servants are still not receiving those assistance as part of the pandemic assistance.
Mduduzi, I mean, it's been the toughest year, and I mean, I'm not allowed to even shake your hand, but I think the nation owes you a debt of gratitude. And I would like to say I hope that you and your colleagues are getting vaccinated quickly and that will protect you. Are you finding that?
The pace has actually been slow, because the last report we received in the first quarter of 2021 is that only 10% of us, which is about 157,000 health workers, have been vaccinated. So we've had that issue. It's long been in politics, the issue of the clinical trials of the J&J vaccine as well. We know about the AstraZeneca, which was our real hope to say this was the one that was benchmarked across the country, and there's supposed to be a large rollout, only to find that the variant that is dominant in our country, and now we have the British and the Indian variant that are now going to compromise, delaying us from getting vaccinated.
Mduduzi, thank you for coming in. Thank you for the work that you do, and strength to you and your colleagues.
Thank you, Stephen.
Mduduzi and Ndlovu, a nurse with you tonight on the Pulse International Nurses Day. Anything you can do to help health workers, of course, gratefully appreciated. Well, coming up, 70